back, everybody, to Chop 10 Community Health to Ask a Provider. My name's Jessica. This is produced in partnership with the Avalon Foundation, and it is my pleasure to be here today with Dr. Melvin, who is one of their fine pediatricians. And today, we're talking about childhood immunizations. So I know that the recommendation is that your baby gets shots starting pretty early. Tell me when the recommendation really kicks in.
So most babies receive their first vaccine before they even leave the hospital, hepatitis B. But then in terms of the regular series of vaccines that we give them in our office, it starts at 2 months old.
2 months old. And I feel like, I know when I was a parent and certainly a first-time parent, I would say the adjective to describe me at my baby's 2-month well check was completely overwhelmed. I think it's a time when you're feeling like a lot of stress, and sometimes the decisions around immunizations, I think, feel particularly heady, in part because you're feeling so overwhelmed and it feels like you're going to put what inside my tiny little baby. So talk to me about why it's so important, and some of the work me through some of the objections that you hear in the office.
Sure, absolutely. So I myself am a mom of 3, and I totally get it. And when I go to the doctor's office, I don't want to be treated like a doctor. I want to be the mom. So I know that feeling, and just feeling like, oh my gosh, the baby's going to be jabbed. My baby's going to be crying. They're not going to be feeling well for the next few days. So I totally get the fear and the concerns that parents have. I think in the COVID era, I've had more questions about vaccinations than I have ever before while seeing patients because of the COVID vaccine. I think a lot of parents have more questions and they're more aware about vaccines and what's going in their baby's body. The most common question we hear as a pediatrician is my child going to have autism because of the vaccine? And the short answer is no, they're not. I think it's a common misconception because the age that most children are diagnosed with autism is between 18 and 30 months of age. And that's when they're getting a lot of vaccines. They get most of their vaccines up until 2 years old. So it's right around the same time. And there was a study published in the 90s that linked the MMR vaccine with autism, and it gained a lot of media awareness, and it sort of took off and went running. But really, 10 of the 13 scientists that published that article have retracted their statements. The journal in which it was published retracted it and said it was false data, and there's been no correlation. After that study, there have been thousands and thousands of children that have been studied in multiple countries, and there's been no link between vaccines and autism. So misinformation got out there.
And mostly the kinds of side effects that you expect when your baby does get these immunizations are so much less dangerous than if they caught these actual diseases themselves. Correct. So talk about which diseases we're trying to prevent, especially in those early childhood vaccinations.
Sure. So there are 14 diseases that we vaccinate between 2 months old and 2 years of age. And they all cause serious illness. They can cause disability and ultimately death, which is why we're vaccinating children. And it's all risks and benefits. And we really feel strongly. And as a mom and as a doctor, I think the benefits of the vaccine outweigh all the risks. So we're vaccinating against Hib, which is a bacteria that causes severe meningitis. So disability and death from that. The pneumococcal vaccine that causes blood infections and pneumonia. Tetanus or lockjaw, polio, which causes paralysis. I should have a list in front of me.
Well, like I said, this is all the stuff that like you kind of like, I think parents need to hear, but feel really overwhelming when you're thinking about your poor little baby and all of these diseases. But again, it's so important. If you have fallen behind on well checks because of the pandemic, maybe you've been feeling freaky about bringing your tiny little baby into the pediatrician's office while the pandemic was going on, what should you do if you're behind on vaccinations? Can you catch up? Is it okay?
Yep. So I would recommend getting caught up as soon as you can. So calling your pediatrician's office and getting your child scheduled for their well check to get their vaccines caught up. We recommend the schedule because some vaccines need boosted to have full immunity, and some require multiple doses to reach full immunity. And children are really at the most risk up until 2 years old, and then really up till age 5 before they start school to have the most serious outcome, which is why we recommend them early in childhood.
Because you're basically training with the vaccines, are basically training their immune system to be able to respond. So Correct. It's like that they're kind of like in training to be able to get to a place where when they are in school, they have a more robust ability to fight.
Exactly.
Oh my gosh, I feel like I've even learned stuff today. This is awesome. Thank you so much for your time with us, Dr. Melvin. Is there anything else you want to say except for go get your kids up to date on their vaccinations.
I would just say, if you have any concerns, talk about it with your pediatrician. We are happy to talk about it. We welcome your questions. I think a lot of parents have concern that they're going to be judged if they express any question or doubt about vaccines, and that's just not true. We're happy to talk about it. We want you to make informed decisions and be comfortable with what's happening with your baby.
And the same goes if you fell behind in your appointments. You know, you want to see the people back in the office. You're not going to be judging the fact that
absolutely we miss them, and we understand too. You didn't want to go anywhere. You know, we welcome you back.
Awesome. I'm Jess again. We're at Ask a Provider with Choptank Community Health and the Avalon Foundation. Have a great day.